Hello, everyone. Good evening. My name is Publio. I'm going to sing a couple of songs, preparing our environment, preparing our heart for the special night. So I hope you enjoy the songs. Good old man. Blue crystal eyes, color of the sky. Gray bushy beard, Santa's look alike. Shine on your brothers on earth, suffering, living joy, or in pain. Blue crystal eyes, color of the sky. Gray bushy beard, Santa's look alike. Shine on your brothers on earth, suffering, living joy, or in pain. Bezerra de Menezes, Apostle of the Good, receive our prayers and also our heart. Bezerra de Menezes, Apostle of the Light, place our pain at the feet of Jesus Christ. Bezerra de Menezes, Apostle of the Good, receive our prayers and also our heart. Bezerra de Menezes, Apostle of the Good, place our pain at the feet of Jesus Christ. Hello, for you that is getting here right now. Welcome to our public meeting. Now I'm gonna sing another song called Vibrate, because in the universe everything is vibration, vibrating light, vibrating love. So vibrate. When life lends a hand, it's time to open up your heart. It's time to love one another. It's time to take part. Vibrate always, loving and serving everyone. Vibrate always, loving and serving everyone. When we give our heart in charity, our lives are transforming into songs. Our dreams become reality, and we join Jesus for eternity. Vibrate always, loving and serving everyone. Vibrate always, loving and serving everyone. When we give our heart everything. Our lives are transforming into songs. Our dreams become reality. And we join Jesus for eternity. Now the song called Calm Me Down, to calm our hearts, to prepare for the special meeting tonight. If I close my eyes to pray, I heard the sound of the sea far away. If I close my eyes to pray, Jesus cradles me, in his arms I sway. Body harmonizes a well-done hay. Music lifts his spirits with sweet ballet. Nature's love, a constant giveaway. In joy, in peace, my heart's find a way. If I close my eyes to pray, Jesus cradles me, his arms I sway. If I close my eyes to pray, Jesus cradles me, his arms I sway. Now a song called Song to Mother Zephyrina. Source of love that radiates, warming up our cold night, support and comfort, support and comfort. Cascades from down the mountain, calling the children of earth, with love in their hearts, with love in their hearts. My soul never loses hope, because your love always teaches me the solution lies in hard work. The solution lies in hard work. Oh, my mother Zephyrina, harvest of wonderful blessings, make your small son a good Christian. Make your small son a good Christian. Now the song called Love in Action. As you can see in the screen, today we have a special meeting, and our friend and brother, Dr. Sergio, is going to talk about autism and spiritism. Stay tuned. Oh, Jesus, here I am, my knees on the floor to say thank you, my Lord, for the lights that come through this door. Your love is the key to change the entire world. Using these chains wisely, we will live in peace and harmony. Now I understand, helping others is helping myself. Your words now are so crystal clear. Your teachings have no frontiers. To see all this transformation, we just have to put love in action. Now I understand, helping others is helping myself. Your words now are so crystal clear. Your teachings have no frontiers. To see all this transformation, we just have to put love in action. To see all this transformation, we just have to put love in action.
Hello everyone, welcome to our Spiritist talk. We thank you for joining us tonight. Before we start, I would like to share a couple of announcements. We ask you to turn off your phone notifications and find a quiet place if possible. Our meeting will have a 30 minutes presentation followed by a Q&A. Then, after the presentation, we will have a spiritual treatment with passes and magnetized water. So we invite you to set aside a container with water to be magnetized. Our meeting is being retransmitted today by Continental Concafres Americas through their Facebook, and we will be also every Wednesday at 8 p.m. by Kardec Radio through their Facebook and YouTube channels. For those who want to learn more about Spiritism, Get to Know Spiritism is a free and online course that happens every Saturday at 5:15 p.m. East. New classes will be started in fall. More information will be given soon, so stay tuned. We offer virtual live gospel at home. Did you know that? The gospel at home is an effective support for you and your family's spiritual harmony. We will motivate and guide you in establishing and maintaining the gospel at home stud meetings. By posting in the chat, you can request it. Please let us know. You are welcome to include your or someone else's names in the list of positive vibrations. It can be an incarnate or discarnate person. And that person you indicate will be assisted by good spirits to provide healing energy and strengthen the goodwill. Please find the link in our chat. We also would like to let you know about the upcoming Alta de Souza Fraternal Meeting on 18th and 19th of May in Oshawa, Ontario. The main topic is Workers of the Last Hour, and the other topics include Spiritual Center, Alta de Souza Fraternal Campaign, and practical activities. More information and links for registration will be posted soon. Every year, on April the 2nd, the global awareness moment connected to the World Autism Day is observed to raise awareness about autism spectrum disorders, ASD. This special day aims to spread awareness about autism as a disorder and to support those who are living with it. It's a global healthcare moment that focuses on acceptance, support, and inclusion of autistic people and advocacy of their rights. So this is a very special day, and we also have a very special guest to talk about autism and spiritism, our brother Sergio, Dr. Sergio Tisi. Um, and everyone is welcome to write comments and questions in the chat, and we will address the questions at the end of the talk. But before that great moment of talk, I will do our opening prayer. So I ask you to close your eyes if you want and follow the prayer. So, divine and loving Creator, as we gather here today in the embrace of our infinite love and wisdom, we open our hearts and minds to understanding of autism through the lens of spiritualism. We recognize that each soul walks a unique path, and we come together in unity to deepen our understanding and compassion for those who journey into autism. So we ask all the blessings, wisdom, and light for the speakers of tonight, Dr. Sergio Tizzi, to illuminate our understanding about the situation, about the autism, and how can spiritualism explain of that existence. So we ask your presence not only in this moment, but during the week and always in our life. So be it. So now I would like to invite our brother, Dr. Sergio Tizin, to join us. Welcome, Dr. Sergio.
Hello. Thank
Hello,
you
thank
so
you very
much.
much.
Thank you. I am very happy again to share with you, to stay with everyone in this meeting to talk about this very important and interesting issue in medicine and in humanity as we are living today because this is a very important challenge in terms of human life in the last decades. Thank you so much. for
Thank
this
you very much.
opportunity.
We are
Thank
seeking for
you, Ron.
your words and wisdoms. Thank you.
My
The stage is
pleasure.
yours.
So, I am very happy. I am talking this again because I am a physician. I am a medical doctor. And I would like to remember with you, my friends, that lives in Canada, in the United States, in the United Kingdom, in Brazil, that during all my graduation and residence program and Master of Sciences, and after this, during many and many years, we do not listen about autism spectrum disorder. The first one, psychiatry, that present to the humanity because of the first paper, he um, talk about 11 boys that have something like three different aspects in terms of differences in terms of normal, regular boys at the same age. This happened in 1943. So in the next year, we complete 80 years from the first paper about this. But during the next many decades, we don't study this. We don't have cases about autism with this kind of diagnosis during our work in medicine. And not only me, but everyone. But we need to recognize that from the last 20 years to now, we are dealing with a growing number of cases in a very special characteristic because of exponential growing in terms of the number of cases with this diagnosis in medicine. I know that this growing number of cases, it is related of two aspects. One, the true elevation, growing of the number of cases around the world. This is not a problem in Canada, United States, Portugal, Australia, Brazil. This is a worldwide uh, problem or situation in the populations of each one of the countries around the world. But we need to recognize that the number that are growing up all the years, it is because the better study about this medical aspect of the humanity. So we, because of the better study, we can recognize in more frequently a number of cases around the world. But it is very clear to the clinicians, to the pediatricians, to my colleagues in terms of neurology, neuropsychiatry, neuropediatricians, and psychiatry specialized in children, it is very clear the growing of the number of cases. For example, when 10 years ago I studied this theme, I analyzed the statistic from the CDC, the Center of Control of Diseases in the United States. We have one case to 85 children born in that time. Today, in the last year of 2023, we have, by the same organization of statistics in medicine in the United States of America, one case of autism patients to each one of 36 that was born in that year. In the other year, one case of in 44 normal, regular children that was born in the anterior year. So it's very clear to us the growing of the number of cases, and we don't know what we can anticipate to the future. How many cases in the next decade or 2 decades to the future? So all of the pediatricians, neurologists, psychiatry, especially in terms of children, all of us, we have a very important challenge to understand, to study, to care, because we are dealing now with one idea or of 0.6 to 1% of the world population with autism spectrum disorder. For example, in Brazil, the same statistics. So we have many and many different specializes dealing with this in terms of the health of our little boys and little girls in all of the country. So this is a challenge. And this is a new aspect in terms of medicine, in terms of the health, world health problem. So, what is autism? The same psychiatry, Leo Kanner, that describes the autism spectrum disorder. We have 3 different characteristic of each one of our patients. We have the idea of some compromise in terms of impairments of the reciprocal social interactions. We have repetitive and stereotyped behaviors. This is very characteristic of each one of these patients. We have problems, this is a very important too, of the communications in terms of verbal and non-verbal process of communications. And each one of our patients, they have the three aspects. This is a triad to everyone. And we know that one time when we define the diagnosis, commonly in the medical sense and approach, we don't have a cure, but we have many strategies to offer to each one of the patients to a better development of their lives in terms of less symptoms or less manifestations in those triad that we comment just now. But we don't work in terms of trying to cure our patients. One aspect in terms of medicine, one more, we don't have one test, one exam in terms of biochemical, genetics, in terms of how to confirm one case of ASD. This is one clinical diagnosis. This do not come from, for example, magnetic resonance, computer tomography, ultrasound. We need to develop the experience to recognize those three aspects in each one of our patients. So we will observe month by month or half year different evaluations to one confirmation that that little boy, more frequently that little girl, he have this diagnosis to be confirmed. But frequently we wait to do this to when we confirm this is the definitively diagnosed. Because this have different implications to the rest of life of that little boy. So we need to act in this fashion with one prudential approach. And one different idea it is that only one neuropediatrician, one psychiatry specialized in children patients, only them they can confirm this diagnosis. Obviously, the suspicion from one family medicine doctor, one common and generalistic in terms of pediatrics, they can suppose this diagnosis. But to one confirmation, because of different implications of this confirmation, only those specialized doctors. Do you understand? One different idea too, it is that when we do the image exams, we don't detect no one differences from the common and tradition and neurotypical brain. But when during the last decades the doctors examined the histological because of the death of the patients with autism from other different problems in medicine, we can point more or less 8 different abnormalities when we compare the brain of the ASD patients with the brain of the common children. So it is very clear this. For example, we have problems in terms of the neural development of those brains of those patients. We have one inflammatory brain in autism patients that we don't have with common or neurotypical brains from the common populations. So, my friends, for example, all of us, we have two brains, the right and the left. And we have one structure between them, the callous core or callous body. And we know that in the brain of the patients with autism, we have a problem in terms of communications between the different brains, the right and the left. And this is something that we have consequences. For example, we have the limbic system, a very inner aspect of the brain related to neural aspect in terms of emotions. And this is changed in the brain of our children with autism. So we cannot detect this with image labs procedures, but histologically, this is a different brain. And we can ask, what is the origin of these abnormalities, this different brain? We don't know. Till now, we don't know. So we need to consider, as we consider the brain of the people and patients with depression. When we analyze in terms of resonance or computer tomography, we do not detect any abnormalities. But when we enter the intimacy of the brain, for example, in depression, we have a level of the neurochemical different molecules, one very low quantity amount of this important neurotransmitters. So the brain of the moderate or severe depressive patients, we can detect abnormalities. It is the same idea of the brain of the patients with autism. One another idea, we have genetical differences, but we don't know the value in terms of heredity, because we do not have one transmission to the parents, to the patients, to their grandfather or grandmother, to the new generations. This was not one medical problem related to hereditary. No, we don't have this. But this is a challenge. Uh, we do not use one medication. We do not have one prescription to do, because no cure, no medications to treat autism. But when we have one patient with anxiety, with insomnia, with some different manifestations that uh, compose the clinical presentation of the case, we can use some medications to help. For example, a very important situation. Commonly, we have epilepsies, we have convulsive crisis in the patients with autism. So, we need to use medications to control the crisis of epileptic crisis. But it is not to the autism, it's to control different problems that can or could stay in that case that we are treating or caring in our clinical practice. Do you understand? For example, when we understand the idea that the patient have insomnia at night, we can use medications, for example, melatonin. We can use anxiolytics to care or to ameliorate this other different manifestations, including as problems in each case of autism. It is frequently, but it is not absolutely present. So in medicine, each case is one case. We do not have diseases. We have patients, and we need to care of them with all of the multidisciplinarity offers in terms of different professionals to care each one of our patients with autism, because we have different levels of these cases of autism. We don't use the expressions, for example, of moderate, light, or severe autism. We don't use these words that we use in other medical problems. We understand levels 1, 2, or 3. This is a worldwide uh, idea from the different doctors in this area. So we need to confirm one diagnosis of autism, what we have as complications of different problems that some with the diagnosis of autism. We need to evaluate what kind of medications that we can offer to the patients. This is a medical approach, but as spiritists, we need to care of the patients with autism with one spiritualistic view, and if possible, as spiritist doctors, because we know that autism, as we have in many different diagnoses in medicine, in adults, in children patients, we need to understand that all of these medical problems, they come from the past lives. They are karmic consequences of bad actions in different lives in the past of each one of us in terms of spirits, in terms of souls. For example, when we care one patient with cancer or a different oncological medical problems, independently of what the organ that are suffering the cancer process, this is karmic. We know many things in terms of the science in medicine, oncology, but we don't know why one cellular cell division comes and after some months we have a tumor, independently of the classification of the histopathological process. We can have the evolution with metastasis and a very big suffering to that woman, to that man with different organs, tumors. And all of them, they are karmic. We have in the body maybe a neurological problem, a gastrointestinal big problem, one inflammatory colon disease. This is karmic. And in medicine nowadays, as spiritists, we are always looking for the spiritual problems of each one of the patients that we have to care, that we want to benefit with one approach that includes past lives, cause and effect law. Do you understand? And in this approach, in all of our cases of autism, and I would like to share with you that we have, because we talk about this in different lives, in different uh, forums and meetings in a Spiritism movement. We talk about this. So we have many and many different cases that are trying to have some spiritual benefit, because one kind of approach that is especially important to our children with autism. So we need the mediumistic meeting because with different mediums and frequently in our groups, uh, mediums, doctors, doctors, mediums. So we open each one of our cases individually. For example, now we will study the case of Charles, 8-year-old from Toronto, Canada, because we have here, as we always ask to the mother or father, the complete name, the date of birth or the age, the complete address, and frequently one video with the clinical manifestation of the child with autism in a medical diagnosis from one doctor of the city of the patient uh, are living. So when we have this identification aspect, we share with the mediums what happened. We open the case individually because each one it's a different soul, a different spirit, a different patient, a different human being, a brother, a sister, and we need to individualize this approach. And in seconds, because of the uh, training of this team of mediums, in seconds when we open one medium, another medium, they are looking the spiritual realm of the patients around the psychosphere of the patients, but frequently, immediately enter in the past lives. And we always find the origins of the bad actions in contrary against the divine laws. And frequently we have many spirits linked to each one of our cases. This is one idea that we need to fix because we are dealing with these patients during uh, 20 years. And always when we open, when we enter each one of the cases, we detect the same uh, complexity of the suffering of different spirits. And frequently we have one change because the patients of the reality that we have, they cause bad uh, problems to the people. And now they are living and suffering the consequences. And the most interesting, when we care of the spiritual environment in terms of spirits, the disembodied brothers and sisters, when we take care of them with love, with one nice approach, from the incarnated group, but obviously with the protection and with the action of the good spirits, doctors and nurses in the spiritual world. Many of them know it in the history of medicine. For example, William James from United States of America, Bezerra de Menezes, and many others. For example, the spirit of Euripides Barçanufo. For example, Ivone de Amaral Pereira, and many others. We have many friends in the team of the discarnated people, always helping us to give to each one of the patients the best that we know and that they can give to us to care each one of the patients. Another aspect, we frequently need to care in different meetings one time or 2 or 3 times, because frequently the cause of the suffering in autism spectrum disorder comes from the wars and many intense human compromises in the past lives. So we need to care, we need to receive, we need the fraternal dialogue with them. But frequently they ask many and many, and we use the fields of love and light to include all of that spirits in a very beautiful procedure, creating by ideoplasty one beauty and nice field to help everyone. We do not left one or two without this benefit. And after this, we guide them to good spheres of the spiritual world around the common life in the incarnated people. And we do this approach and we transfer to the parents the idea of what happened in the past. And we suggest, observe your son or your daughter. Including, we have cases of families with 2 or 3 children, all of them with the autism spectrum disorder. And in one family or other, they are different genders. This is very interesting to study all of them. But when we tell the parents, mother and father, about this approach, and they observe frequently after some days, some weeks or months, we can see the before and after this treatment in terms of mediumship meetings to help the past lives where we have very important dramas involving many different people, spirits, discarnated ones, and always guiding them to the good life uh, in hospitals, and structures where they will continually have the helping from the good spirits too, independently of new different means. Uh, can I continue?
Yes, sure. You can finish. You have a couple of questions to do, so the
Yeah,
time
I
is.
would like only to maybe conclude this considerations because today we have the April 2, the day indicated by the United Nations to account awareness of the autism around the world. And I would like to share with you one interesting aspect, this unique, because last year in April 2, I asked one very fine medium, doctor of family practice that work with us in the Spiritism meetings. And I asked to this medium to concentrate, to ask the spirituality about autism. And I have to share with you one a surprising text about autism. And I would like to present to you, maybe, and then we can pass to the questions. Okay? I will present to you um, here this. A few decades ago, medicine included autism spectrum disorder in its list of diagnoses. Children with changes in development and behavior causing suffering for themselves and the whole family. Why so many children with this diagnosis in recent years? We Spiritists who seek to understand the causes and consequences are always trying to make associations. However, one should not lose sight of the fact that any suffering of greater or lesser intensity is related to our past mistakes. The earth is in a transition process, and the spirits need to experience trials and atonements to keep up with the planet's moment and evolve together with humanity towards a world of regeneration. Diseases, epidemics, catastrophes, wars, and destructions. Despite so much pain and suffering, Jesus is in charge and gives each of the smaller brothers and sisters the best opportunities for individual and collective development and evolution. Jesus. How many families understood that they needed to come together to care for a child diagnosed with ASD? How many mothers and fathers learned to love their children unconditionally, living in extreme emotional conditions on days of greater difficulty? How many couples have recognized the value of life and marital harmony in their day-to-day struggles, each one renouncing the vanities and their pride to dedicate themselves to the home. Every pain brings teachings and healing. Unfortunate is he who does not know how to understand, learn, and grow with suffering. Sick souls that we are, apprentices of Christ's teachings, we should be grateful to all the opportunities we receive to reach spheres of greater spiritual lucidity. To finish, therefore, spiritists, children with ASD, and all the sufferers in this world are also our responsibility. Reception, care, guidance, charity, and love for all of the Christ guidelines for all for us. The signature, Lucas. This was psychographed 1 year ago in the last April because one idea that we would like to have from the good spirits and Luca in the name of a big team of good spirits that are helping us from many and many years. So, Rod, thank you so much, and I am here to hear from you about the questions.
Dr. Sergio, thank you very much. As always, your talking is a success. We have a lot of questions. Because the time, we will send those questions to you to be answered. And it's the clarification of your knowledge about the importance. And this final message bring to us the responsibility to deal not only with autism, but all the situations to be helpful. So thank you very much. It was a great talk and very, very touching.
Thank you, my friend. And I will be waiting uh, for the questions from our friends that are sharing with us this time to study this very important medical problem in this humanity on earth. Thank you so much to everyone, and it will be another pleasure to stay with you in the future too. Thank you so much.
Thank you. It's always a pleasure having you here. So thank you once more to the Dr. Sergio Chizen for this amazing presentation. So we will now move to the preparation for tonight's spiritual treatment. PASS is the transfusion of spiritual energy with the goal of assisting with our physical emotional, and mental balance. Passes help us to restore a state of harmony and peace by replacing negative energy with healthy and positive energy. In order to receive the best benefits from passes, please follow the audio instructions or remain in prayer. You may close your eyes to help with mentalization. During the passes, the water you set aside will also absorb the spiritual energy that your family and you can benefit from. We will now make a prayer in preparation for the passes, which will be our closing prayer as well. So, once more, we can close our eyes, elevate our thoughts. Now, with full of energy after this great presentation, will bring us to understanding more about our situation, about the autism and people living with autism, being our responsibility with each other, with the practice of charity, understanding, and love. So we ask for the good spirits to receive all the healing energy for the treatment of this night, knowing that can be the first night of our changing. If you are seeking for a relief, a cure, or even to improve our moral values, so that can be the night where we can change our path to this incarnated life for our spiritual life in the future. So we thank the presence of the good spirits and ask them to stay at us today and always. So be it.
Let us now prepare ourselves for the moment of the passes and the magnetization of water. Let's now calm our hearts, breathing in and out. Pay attention to your body. Focus on your breath and let yourself be carried by this energy. Let your thoughts pass by without judging them. Let them flow. Allow this light to be the beacon that guides you, and allow these words to penetrate your energy. Make each word an anchor of gratitude, faith, and trust. With the purpose of healing, which takes away my faith, healing every feeling of separation, of pain, let it all dissolve in this moment, leaving only love, gratitude, and trust. We ask God for the presence of our guardian angel and the friendly spirits who welcome us into this enlightened environment of our Spiritist Center. We open our plexus of love and forgiveness by mentalizing a light surrounding our hearts. Find a quiet and comfortable place to begin the mentalization process. Remove all worries from your thoughts. We ask that during the pass you breathe slowly and deeply. Let your body relax and surrender yourself to a deep meditation. Calmly imagine divine energies in soft and colorful light surrounding you in an environment of peace and spiritual warmth. Entrusting God with your most intimate desires, raise your thoughts to Jesus and the emissaries of the spiritual environment. The pass begins with the cleansing of your soul. Imagine a waterfall of crystal clear water pouring over us, removing all the feelings that keep you away from faith and trust. Feel the energy of this water bathing you and deeply breathe in, feeling peace and harmony. Allow this water to wash away all the impurities and spiritual larvae, washing away all the sorrows and resentments, any feelings of hatred and revenge that hold us back and cause us harm, not only from this life, but past ones as well. Now visualize spiritual doctors around you, applying magnetic cleansing passes, sanitizing your spiritual body of all sadness and negative energy. Mentalize these negative thoughts and feelings being washed away, evaporating from your soul, like water evaporating into thin air, and being carried far away from your mind. Surround yourself with the faith that bathes your being, bringing clarity and lucidity, rebalancing every cell in your body. May the water envelop all pain and bring the clarity of opportunity that chooses peace. The answer arises in our hearts, freeing us from all evil and freeing all whom we have caused evil into and who have caused us evil, washing away all the connections that bind us. Even though we may not understand, we are freeing ourselves from all that causes us harm. Feel this cleansing penetrate your soul and release. Now that we are spiritually cleansed, imagine yourself surrounded by the light of love from the hands of Jesus. At this moment, sing words of faith and gratitude, being faithful to the light that exists in me, planted by the Zealous Father. Imagine the sunlight that surrounds and enraptures, freeing us from the chains of everything that holds us down, strengthening your faith. Allow yourself to trust in this light, surrender to it, involved in pleasant feelings and feeling relieved to receive the strengthening lights. Mentalize your spiritual mentors now applying divine light for the strengthening of your mind and your emotions, leaving you feeling emotionally revitalized. Let us now mentalize the magnetization of this water. May we mentalize all the friendly spirits, magnetizing this water and filling it with everything that our bodies, minds, and soul need, so that it may be of help to us when we drink it after the pass. Thank you, God.
In continental Concafres America at 8:30. From Spiritism Canada and Spiritist group Path of Light.
Wherever you are, glowing seeds of love, as our Master Jesus taught. You will see that behind every sight there's a flame shining bright, tiny spark created by God. here.